What are some of the hardest conversations as a medical oncologist you think are had?
I would say the most challenging conversations that I have with a given patient is when it's time to end therapy, and patients don't always see that coming. The goal of the therapies we give, as I've said before, is to provide the longest amount of time with the highest quality of life, not to provide the most therapy possible. And sometimes that may mean redefining what fighting looks like and what the goals are. But we like to have this perception that it's always the patient's choice, and it's not. Sometimes when we just run out of reasonable therapies to give, the patient may want more things, and we just can't do it. It's not safe. It goes against our moral code, and that's really hard. And you get second opinions for people who come across the country and they're hoping you have this thing that's going to reverse cancer growth, and you just don't have it. It doesn't exist, and you have to tell them that they really are at the end of the treatment road, and now it's time to just focus on symptoms. And that conversation doesn't happen when the patient's ready. It happens when the tumor's growing. And that's really hard because we want to be the people who are able to offer hope. And a lot of times that's our bias. Physicians very frequently overestimate the duration of time their patients are going to live. And they overestimate the amount of time therapies are going to work because we are biased toward hope. But sometimes when patients are just too sick or there's just no more treatments left, and it's really hard to tell someone that. That's definitely the hardest part, I think. We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit krakencancer.org to join the Kraken Cancer community.